It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good morning. Good day, everyone. I want to thank you all from the bottom of my heart for tuning in. There's so many places you can be and so many things you could be listening to, but you're tuning in right now, listening to NuWellness TV with yours truly, Dr. Lee. I want to thank you. I am so excited for my guests who I have today, and because we're covering a topic that so many people are having so many problems with. I was in the store in the market last night and ran into a dear friend and told her what the topic was going to be today. And she said, that's one of my problems. Oh my goodness. I'm so happy that you're having a topic dealing with environmental conditions as it relates to the libido of men and women. But I want to just say that my guest is a renowned known. And she studies hard. She is an MD, PhD. Dr. Lu, she is phenomenal. And I just want to say the show today, we're going to cover a lot of information. So I want everyone, please get your pen and paper out now. Please share this show because everyone from birth in utero to every age is being affected right now. So you must take notes and take heed so that we can help you to have a better quality of life. So you can have one. That's why I have a better quality of life. And most people know my story of being in a coma twice. And I have a great quality of life and a grandmother of 10. So this is what I want for everyone else. This is why I'm doing this show today. And this is why I have my fantastic guests with me. So we're going to be covering a lot as it relates to EDC. And a lot of you might have heard the initials EDC, which stands for endocrine disturbance chemicals. And these chemicals disturb your whole endocrine system, which is your entire hormone system, which will cause you to have problems with decreased sexual function, respiratory, mental problems. Every system in the body is affected. Your lung system, respiratory, nervous system, every system is affected. So we're going to go through today with my wonderful guest who loves the research and has a lot of wonderful information and to help you, to help yourselves and help your family. Thank you so much for joining me, Dr. Lu. I'm so excited. I'm so excited that we can share this information to help people heal. That's why I'm excited and that's why I'm smiling, because we shouldn't have to suffer. It brings tears to my eyes sometimes to see so many people walk in my office suffering needlessly. So I am so happy. But first of all, Dr. Lu, tell me, you're a medical doctor and PhD, but now you're more into so many names for it: functional medicine, integrative medicine, complementary medicine. There's so many names for holistic medicine as most people sort of know it. Tell me why, number one, did you go into medicine? And then I want you to tell me why did you go into more the holistic approach?
Yes. Hi, everyone. Dr. Lee, my mother is a Chinese cardiologist. She's MD. My grandmother was a Chinese traditional healer. So I grew up in these two generations of incredible women who want to love and care for the sick and the weak.
Yes.
So, I grow up to want to be like them because I can see their incredible full life revealed to help others. And I feel that is something I thrive for, is to help as many people as I can. I decided to follow my mother's path because, as you all know, Western medicine give you certain rescuing power when people are in emergency crisis.
Yes.
But quickly after I started becoming an internist in Mount Shasta, California 20 years ago, I became very disillusioned about the way Western medicine address chronic illness.
Yes.
Not only they're not rescuing people in any ways, they're simply managing the sickness.
Yes.
The problem is when we learn about Chinese medicine, when you use drug to manage symptoms, what happens is that human organs become damaged as a consequence of polypharmacy, right? That's
Yes.
number one. Number two, people are losing the quality, the desire, the love, and the incredible vitality, because they're adding more and more treatment to cover the symptom or merely treating the numbers of the lab and diagnosis.
Right. And I just want to say,
very busy.
Yes,
Yeah.
yes. And you have a wealth of information. This is why I'm going to have you on monthly, because you have a wealth of information as well. And we both kind of went into the same trend, even though I'm not a physician. I'm a PhD and nurse practitioner and physician assistant and you name it. But this is one reason why I got away from the hospital clinic rim too, because of my own health and seeing how just what you said. They're not looking at the person. They're treating a disease. You never look at the person and treat the whole person. And that's what I don't see. As you notice, there's been a shift in the paradigm where they're starting to look at, and you see advertisement now with a lot of HMOs. Oh, we treat the whole person now. It took you how many years to treat the whole person, which is sad. And it's still not quite there. So one medicine, you give one medicine after another, and that suppresses another system. And all the medicines are disrupting our endocrine system. So even when it comes to hypertensive people, and people who are diabetics, and you have more and more and more. I mean, why aren't you healing people's kidneys instead of putting more and more people on dialysis? That's just clueless to me. I know why, and it's big, we know why. But, it's just sad to see people are, I just want to share this one little thing. There was a little cartoon kind of deal where this man said, this doctor came into a room of a patient sitting there, and he said, he tells the whole family and all the doctors are standing around. They said, by golly, we got it all. The patient is lying in the bed. Visualize this patient lying in the bed. And the doctor said, by golly, we got it all. We got it all. Only thing left in the bed is a head. There's no body. So they got it all. There's no cancer. There's nothing, but it's only a head. Where is the quality of life? That's my whole premise of what I do. Where's the quality? You might not have every disease covered. You might not say everything is gone, but your quality of life is going to be so much better when you do things that we do in our practice. And we're going to talk about too on the whole detoxing and the healing. So yes, we're going to tell you all these things that are happening to you, but there is a cure. I won't say cure. There is a better quality of life and getting these toxins out. And then you want to know how are they there? So at NuWellness Healthcare, we do the testing, the same as you, Dr. Lu, is doing the testing. We do the testing to find out what is going on. And so as you go through this journey, that you know that your body is healing, which is so imperative. I'm going to let you take the floor now and run with it. Dr. Lu.
Wonderful. So Dr. Cherilyn Lee has been an advocate for her patients and finding the best way to improve their lives and also the life experiences. So I always tell people, we all are, dying the day we are born, and how we are going to experience life to the best capacity we can.
Yes.
I don't have judgment if people want to do the surgeries, the burning and the killing and the drugs, because that's what that's really what they want. That's okay with me, right? Somebody have to do that. But I really want to awaken the general public and share with them life can be lived in such a pleasure, joy, vitality, and abundance.
Yes.
Life does not have to go on down the hill until we have 500 diagnoses, right? So
and 500 pills to take as well.
500 pills and multiple organs removed.
Yes.
So I want people to understand right now we're facing the biggest challenging time in human history.
Yes.
And we're hoping it will get better, because as people are waking up to the chronic suffering and deterioration of our life,
yes,
some days we have to say enough is enough.
yes,
So the first step is to make toxins visible. And in the past, I would say 6 months, I have been working with national level physicians to massively testing people's toxins and help them wake up to see how much toxins they are loaded their body with, and teach them how they can get rid of the toxins, because our body love to heal.
yes.
Our body have all the elements to heal, but you got to get rid of the dirty blockers,
Yes.
right?
Yes.
So I want to share with people this screen. We're going to talk about endocrine disrupting chemicals. And of course, people say there are different kinds of chemicals, and what are the dirty dozen, right? What are the main endocrine disrupting chemicals? I want to go over what is hormones. Hormones are produced by our endocrine system. We have a cascade of them, from pituitary, hypothalamus pituitary, to your thyroid, your sex hormone, your adrenal gland, including your pancreas.
No, I just want to I want to just stop you there, only because I want the people, our listening audience, to get a clue of where these hormones are located. Mostly everyone know where the thyroid is located. The pituitary gland, they maybe know it's in the brain. The adrenal glands sit on top of your kidneys. So you want to know where these hormones are sort of located, and a little bit about the function as we go through this journey, because then you have a clearer understanding what they're secreting, what they're doing, and when things are off balance. It's not just one. So when you go to a doctor, or you go to, I would say a doctor, because they're going to, if you say, well, I have a thyroid issue, they're only going to look at one hormone. In most cases, they just look at TSH. They don't even look at everything else, and they don't look at the pituitary. So you got to look at all the hormone systems. This is why EDC, hormone disruptive chemicals, affect all the hormones. It's not going to just affect one. So you have to be very clear as to these hormones and these endocrine glands and where they're located as well, because that's going to tell you a little clearer picture of what's going on with your body.
Yep. So as we know, hormones are produced by each gland.
Yes.
Hormones are then carried in the blood in the free form or bind form to a protein to the peripheral target receptors. Now, this is very important. If you have poor circulation, the hormones will have trouble reaching the target receptors. And then once you get to the receptors must be fully functioning for the hormone to have its benefit or physiological effect. And today we found hormone disrupting chemicals are not only interfering the transportation of the hormone, but also the receptor availability. And then once the hormone finishes its effect, it needs to be metabolized safely by the liver, oftentimes, and getting rid of it, because you don't want the hormone to fly around in your body for too long.
No.
So endocrine disrupting chemicals affect the hormone function through production, through transportation, receptor blocker, metabolism disruptor. So there's a lot of different steps these chemicals can affect us. Now, people say, how do you know I have these endocrine disruptors? Oftentimes, people have symptoms of low sexuality. They don't have sex drive. They don't have reproduction. That's normal. Women oftentimes have trouble sleeping, gaining weight, have trouble feeling anxious, just feeling anxious, depressed. And also, some people just measure their hormones, their levels are normal, but it's not working. I just talked to a woman, when she was going through menopause, she went to see her functional medicine doctor.
Yes.
And she started the bioidentical hormone program, and because she was now sleeping, right?
Right.
So she started the hormone, and immediately she started losing hair. She's now sleeping. She said, doctor, you told me I need to get hormones. Now I get hormones. Everything get even worse.
Yeah.
How could that be?
I've seen it.
Right?
Mm-hmm.
So what's really missing is the endocrine disrupting chemicals
Yes.
have been blocking not only the liver, but also blocking her receptors.
Mm-hmm.
So the hormone replacement therapy today in the 21st century must require all physicians to look into the endocrine disrupting chemicals, because otherwise the benefit is not predictable anymore.
No.
That is no longer sustainable. I have been teaching physicians who are into bioidentical hormone treatment. You know, these are open-minded, integrated physicians.
Exactly.
And suddenly they are seeing patients falling off the wagon.
Yes,
because
they are.
the endocrine disruptors are everywhere.
Yes, they are.
Yes.
And that's from, we'll go through that, especially in the makeup people, the women, and then the perfumes, as we know, there's so many, but we'll go through the ones that are in your home, the ones in environment, the ones that are they're just all around us. And they enter the body in so many different levels, through breathing, through skin. They're going to enter the body. So some things you use topically that are endocrine disruptors. So you just have to know what's going on. Because I thought that, the hormone replacement therapy was going to be something great until years ago, until this started to happen. And I told people, in a nutshell, what you just said, when we looking at the hormone receptors and making sure that everything is doing what it's supposed to do, it's almost like a key. So if you change a lock on the door, just change it just a little bit, then it's not going to open that door. So this is what's happening with these receptors and everything, get it into the pathway of where it's supposed to go. If it's changed just slightly, it's not going to work. And this is what's throwing your system off.
Mm-hmm. Correct. So let's go over, I want to start with a story, because sometimes people can relate to a story.
Yes.
I have a 63 years old gentleman, and he lives in Mount Shasta, very active and healthy man. Okay, I'm going to show you his data.
Okay.
So he came because he is, his wife was getting so healthy. So he said, Dr. Lu, I want to try something for myself. I don't know if Tony can show this slide. Okay. Can you see it, the slides?
Yes, he can.
Okay. So this is the man that came in and said,
we're kind of losing you a little bit. We lost you. Dr. Lu, we cannot hear you. We're working on it. So maybe we'll just remove his lab and you come back on so that you can explain it, okay? Because I think our viewing audience had a chance to see the lab that's posted. So if you're listening to the show, please go to the YouTube channel so that you can actually view what we're showing on the screen. Okay, so right now we kind of lost you, Dr. Lu. I don't know if you can hear me, but I do want to say that once you start doing the testing, making sure that, and blood tests can be done. This is done through the blood. So we can do the test and we can find out exactly what's going on. Okay, so she's back. Okay, so we'll just talk about his lab results instead of posting it, because some kind of way we kind of lost you there. So go ahead.
Got you. Okay, that sounds good. So basically, the man has testosterone of 262, and his PSA is elevated to 4.6. His fasting sugar is also elevated to 110. His ferritin, which is iron overload in the liver, is much higher. You also have mild elevated CRP and mild elevated liver enzyme.
And CRP is your inflammation marker.
He gave me 2 months. All we did, exactly. And he did 2 months of the detox program cellularly. And he said, I am off Prozac, Lipitor. I feel 20 years younger. I sleep deeper. I breathe much easily when I'm skiing. My sex drive is better. I drink less alcohol for some reason. I just feel so good.
Yes.
My chronic low back pain is almost gone. Okay. Now, I did not give him testosterone. His testosterone went up to 451.
Wonderful.
His growth hormone improved by 40%. His PSA came down. His fasting sugar came down. His ferritin is better. And you can see his CRP also come down. His liver function come down. So the lesson I learned is when you detoxify the body of stress and environmental toxins, your body will heal itself naturally. Okay. So that's the part I always want to encourage people who are interested in testosterone therapy or hormone replacement. Give their bodies 3 months to detoxify and see how much the body can do by themselves, right? And then you can always do hormone. I strongly against jumping into hormone replacement right away without cleaning up your body. Yes. And that is my biggest lesson I learned after practicing hormone therapy for 20 years.
Yes. And I'm so thankful that we do have a program. We do have a program for detoxing. So we'll be sharing that at the end of the program, and the people can call me at NuWellness Healthcare, and we can tell you exactly what that is to get you going on the program, which is phenomenal. And I thank you so much, Dr. Lu, for sharing it with me some years ago. So it is a phenomenal program, and that's how we met. That's how we met.
Yes. Now, Dr. Lee, I'd like to go over the Dirty Dozen. This is different Dirty Dozen from the fruit and vegetable Dirty Dozen. Yes. This is the top 12 hormone disruptors, okay? Okay. I really want people to go, number one, they can screenshot this one, or they can go to EWG and then just Google hormone disrupting chemical. And you can download this little booklet. It's free. It doesn't cost anything. Great. I support EWG. I want people to donate money because they actually really scout for our for people, for the consumers. Wonderful. Now, the first number one endocrine disruptor is called a BPA. We're going to go into BPA. BPA was initially discovered by a pharmaceutical company to be an estrogen replacement option, okay? It's called a bisphenol A. But quickly, during their phase 1 trial on animals, they found BPA caused breast cancer, gallbladder infection and stones, and proliferation of the reproductive system. And they found it's actually very dangerous for metabolism. So they decided to get rid of it, okay? So the food packaging company somehow discovered it. And they said, oh, this environmental estrogen, pharmaceutical estrogen, is actually really good to make, plastic lining bottle, the can lining, and the receipt in the market. So now we tested people, 93% of Americans have environmental estrogen in their bodies. Okay, now when we talk about synthetic hormone, there's nothing stronger than BPA. Exactly. I just want you to know what BPA do is they stimulate the fat cells to grow, they stimulate the insulin resistance. They actually make grow man boobs. Okay. Now, BPA has been difficult to be eliminated because it's so persistent, and a specific cellular detox mechanism is required to remove BPA. And I just want you to know, sauna itself probably won't do it. And also you need to make sure you have a plan to eliminate BPA completely and prevent BPA being recycled back into the liver. And that's actually a process we need to go deep in to dig in and get rid of BPA.
Yes.
Okay. Now, BPA has been number one cause of female obesity also, because they grow the fat around the hip. So if you have a lady that used to be skinny and suddenly have this huge hip, you need to understand that is not from bad food alone. That is definitely BPA in action.
And it's also the thigh.
Hormone-related.
It's the thighs as well. It's the hips and the thigh. So you'll see it in the outer thighs too.
Yes. So that's number one. So if you go to a store, try to skip the receipt. Don't buy canned food. Maybe sure there's nothing in the lining. Eat whole food fresh. Also, plastic bottle, you have to be really careful about the plastic bottles. And I think that ironically, Dr. Lee, is I'm a cyclist, and it's very hard to carry a metal bottle or glass bottle on a bicycle.
I know.
So we continue to struggle with the fact, we use the water bottle that is plastic.
Right. And
another word of warning, sometimes they replace BPA with something else. You have to be careful because all plastics are made of petroleum product. And if you look at what is petrochemical are the hormones of the dinosaurs. They are the estrogen of the dinosaurs. So you just have to understand it's not a benign natural product. It is mimicking your hormone in many other ways. Okay. So that's number one. Number two is dioxin. I'm sure many people heard of dioxin. There are many different kinds of dioxin, and they are found in cheese. Okay, very, very sad. They're in cheese. A lot of people like cheese, and because it's pretty addictive. Once you are addicted to that casein, it's hard to get off. But they found out dioxin actually, even at low level in the uterus, you can start having premature sperm quality decline and lower sperm count in men during their prime reproduction years. And the dioxin work in low dose. That's something that really it's a powerful carcinogen.
Right.
It can affect your immune system and reproduction.
And you know something.
And many of them didn't know. Yeah.
Dioxin was heavy in the sanitary napkins and tampons, and was linked to endometriosis as well.
Yes.
Yes.
Yes. PCOS.
Yes.
So I really want people to know. I know a lot of people on the paleo diet. They just need to know products including meat, fish, milk, eggs, and butter are most likely to be contaminated. You need to cut down on your exposure to eat fewer of animal products. Okay, so this is actually from EWG. This is not from plant, group. This is actually from EWG talking about dioxins in animal product.
Exactly.
Okay. Now, number 3 dirty dozen is atrazine. I'm sure people heard of atrazine. It's the number 2nd most used chemicals in spray atrazine to male frogs. Okay, these are developed male frogs. If you spray atrazine on them, they will become a female frog. Okay, you can actually study this study. They spray on the female frog, Okay, the male frog, it will into a male frog into a female frog. Okay, this is scary.
It
This is
is.
absolutely scary.
And don't take our
You
word
should
for it.
not
Research it. You're for yourself. Research it for
research it.
yourself.
Or even better, have a frog and do experiment. You will see one frog will be having eggs with the other frog. They can actually show you. Atrazine is actually linked to breast tumor. Recently, we have a beautiful anti-aging doctor. She started cutting off her breasts because she thinks that is the best way to prevent breast cancer.
Mm-hmm.
But little does she know, if she's exposed to atrazine, even though she has no more breast tissue, because you can never remove all breast tissue, the breast tumor will grow in the spine and other places. So I just really want people to know true prevention is not to cut off your organs.
Yes.
Now, if you really have tumor, a lot of bleeding fibroids and stuff like that, you can cut it off. But I think for prevention, you really cannot just cut off your organ.
No.
I'm really against that approach. I think a lot of people do that because of the fear. But true prevention is to detoxify your body.
Yes.
That is causing, these chemicals that's causing cancer.
Yes.
What do you think, Dr. Lee?
I feel the same way. I know a lot of people have, and we had an entertainer, well known, who had bilateral breast cancer, breast surgery, and everybody start doing the same thing. I won't mention the name right now, but I have a patient who did the same thing, and they said, my goodness, it was so minute in the breast, it was barely there, but she wanted to have the mastectomy. So I also feel that way. I mean, I've had polycystic breast disease in the past that are all gone, but I didn't have a mastectomy. So I feel that you really should. Removing organs and radiating organs and all these other things are going to set you up for other problems down the line, because you're not going to get rid of it, because people forget this is the whole body. It isn't isolated. The liver is not isolated by itself. The thyroid is not isolated by itself. That's blood circulating through the body. So removing that organ is not going to change a lot.
Yeah, very good. So the number 4 chemical is phthalates. Phthalates is a specific chemical that has been used a lot in cosmetics and plastic food containers.
Yes.
And recently, my husband and I decided to throw away all the plastic containers and change them into glass, because the benefit is really getting rid of these, these are not xenoestrogens. They are just, we call cellular deaths. This is actually showed phthalates can kill your testicular cells. And it's called the death-inducing signaling in testicular cells. Now, a lot of people.
So you're saying death? You're saying death?
Death.
The death. Okay.
The testicular cells to die.
To die. Okay.
Now, what's interesting is I recently met a beautiful yoga teacher in Los Angeles. She goes to these parties a lot. She is actually looking for a mate. She's beautiful. She's mature. She's financially stable.
It is not me.
And, she's successful. She goes to the party. She's like, Dr. Lu, I don't get turned on by anyone there. I mean, she loves them. They're friends, but she does not feel the testosterone. Okay. Now, many people don't understand. Hormones are actually pheromones. People have good hormone level will attract their mate effortlessly.
Yes.
Effortlessly. Okay. If a man have low testosterone, and he can be rich, he can be looking good, have good clothing, but if he doesn't have testosterone, the woman will not be attracted to it.
Yes.
Period. Because we are biologically made to attract the man with high testosterone.
Yes.
Okay, that's the way it is, because that's the biological imprinting and survival mechanism. Right now, what's concerning me is the millennials are not having sex. Do you know that? The young people are not having sex. And I'm not promoting sex, but I'm really thinking,
I understand.
What's going on with the young people's endocrine system is they are losing it. They're losing it. The woman, we still produce estrogen. Sometimes we don't produce as much progesterone because of stress. But man, the testicular cell death is not a joke.
You want to say where it's located so that they would know where the testicles are. I mean, most men know, but a lot of people, sometimes these are medical terms, they may not know. They know the name, yes.
So I would support, people use all natural glass-made product. If you are using cosmetic, you got to make sure they are all natural ingredient, not synthetic hormones.
Yes.
Okay. Anything with phthalates, with recycling label number 3, you got to avoid it. Because once it gets into your body, start killing your testicular cells, it's probably hard to get out. Okay. So decreased exposure is really a lot of work. It's actually not a lot of work.
Yes.
You just go into the store and buy everything made of glass.
Read your labels.
And read the label. Don't use anything you can't spell. Right?
Yeah.
So
or pronounce.
If it's olive oil, shea butter, that you can spell. It's from nature. But if you are reading phthalates and pregnenolone 40, all these things, those are hormones.
No.
I would avoid that. Perfume is actually hormones. People like perfume a lot. Many of them didn't understand. They mimic the man's cologne, mimic testosterone, try to attract women. The woman's perfume maybe worked, Dr. Lee. It actually did work for a while. But after too much of the fake hormones, the internal signaling, the woman's nose, it's going to sense this person does not have true testosterone.
Exactly.
So I just wanted to know, because the man really liked perfumes. Okay.
Right.
So it's not going to be a sustainable way to attract women. So the next one is perchlorate. This is actually one of the biggest hormone blocker against your thyroid. Now, I actually had a personal experience. I was doing really well, doing fantastic. My thyroid is recovering from autoimmune. Then I went to China for about a month. I came back and gained about 8 pounds. Now, I'm a little person, so the 8 pounds actually do show a little bit.
Okay.
So I said, what happened? So I measured my perchlorate, and my perchlorate was elevated to about 75%. I started measuring people in Mount Shasta, in Los Angeles, in Mill Valley. Many people have perchlorate. Now, perchlorate is a rocket fuel. How did it end up in our water? Do you know? Well, it shows actually a lot of food and water are contaminated with perchlorate. Perchlorate comes from the fire, the little flares on highways. Our police officer use to, indicate there's some kind of accident.
Right.
Well, it turns out perchlorate is very water soluble. If they're left on the freeway, the rain comes. We are having rain today. It gets washed into the water, and it gets into your aquifer. And next thing is it shows up in your water. Okay.
Yes.
Now, big country, crowded city, lots of accident could be a reason for increased perchlorate in your water. I recommend everybody do a reverse osmosis water filter. I know it's not the most efficient water saving osmosis water filter,
Right.
but it's worth it.
Mm-hmm.
You need to
Yes.
do one, and then Costco has a cheap osmosis. You can use it. Okay. So this is a very important contaminant. We even find it in Mount Shasta, which is really sad. Mount Shasta has the best water. How did these people get perchlorate?
Right.
So that's one thing. Firework. People like firework. Do you guys like firework?
Well, I like to watch them, at a big at a big field somewhere, but no, I don't want to do them myself.
I know. We have the July 1st firework. I think that could be a reason we have perchlorate in our water now.
Yes.
We just have to be careful with that.
Yes.
Okay. The next one is fire retardants. This is the one that it's a government regulation. Is they found fire retardants are regulated. The furniture have to be tested for fire safety. Apparently, some people smoke in bed and set the bed on fire. So now it's a conventional bed, particularly such as Tempur-Pedic, lots of the foam, memory foams are, many different cheap versions. They're supposed to be there to support our body when we're aging. It's supposed to be good for our body. But many people don't know those petroleum-made mattresses are easily catch fire, right? It can explode. So the regulation to put these chemicals on the bed is tremendous. And they really have to. It's not like the manufacturers just want to, is they really have to pass the testing. So that's why they put so much fire retardants on the bed, on the foam memory bed. And we actually changed both of our bed into natural bed now, because once you learn how much fire retardants is on the bed, we sleep on it 8-hour day. You don't want to absorb those chemicals.
Right. And now, they make your pajamas, the kids' pajamas, that same way, using that type material. So it's in a lot of things that we wear too. So we have to really watch the labels. Your pillows are supposed to be non-flammable as well too. So you'd have to watch what it is you're wearing at night to sleep in.
Yeah. And another thing people didn't know, infertility. When we talk about infertility, and they talk about in the past, the infertility clinic went up by 400 times in this country. Yes, a lot of money to be made, but nobody is asking why this fertile woman and man suddenly cannot get pregnant.
Exactly.
And we need to look at endocrine disrupting chemicals. Lots of people have the children through that infertility treatment, which is great. But at the same time, many of the children are already loaded with chemicals that's going to affect their life, very quickly.
Exactly.
So some of the fire retardants have been shown to cause male infertility on the 3rd generation. And so sometimes the parents don't even have symptoms, the children don't have symptoms, but then the children's children will show complete infertile for the rest of their life.
Exactly.
It become a species extinction on the 3rd generation. So, of course, Americans are really into the immediate benefit. Do I have symptom? I don't have symptom. Therefore, I don't have to worry. It's really short-sighted. This whole deal we call dysfunctional medicine or dysfunctional living.
Yes.
Is we only look as far as 50 years. We don't look at next generation. No. We don't look at planet health. If our planet is loaded with these endocrine disruptors, the planet will keep going, right? We're going to see 60% of wildlife extinction, and the humanity will not be here. If everybody is short-sighted, that's what's going to happen. The planet will keep going without us,
Oh, yes.
I just want people to know it is time for us to wake up together and really take our life into our own hands. We cannot rely on this conventional way of dealing with the crisis, getting the treatment for symptom. We got to look at the root. My purpose in life is to help people build a healthy, non-toxic community.
Okay. You know, I just want to say this. I have to stop you for a minute because I was just given the clue that we have 5 more minutes. So, not that I want you to go through it fast, but I do want to cover everything today. So we have about actually now 4.5 minutes. Okay.
Okay. 4.5 minutes. Let's go through.
Let's go.
So lead, also an endocrine disruptor.
Lead.
Arsenic is oftentimes happen in rice. You need to soak your rice. Okay. Mercury is endocrine disruptor. Many people don't understand.
Let's go back real quick though to rice and the arsenic, because a lot of people were unaware. I had a patient who I did a test on, and she actually thought her husband was poisoning her because her test kept coming back high of arsenic, and not knowing she was eating a lot of rice and it's coming through the rice. So is this brown rice and white rice?
Right. Yes. So basically, a lot of the rice, even organic, if the water is contaminated, you have to be careful.
Yes.
So we usually have people soak the rice. Soak it.
Soak it.
For a while.
Okay.
Yeah. So the next one is mercury. How many people think mercury is endocrine disruptor? You know, we have you need to make sure the mercury is out of your system.
Yes.
Okay. Fluorinated chemical. We talk about the Teflon pans. Apparently, there's a study showed the woman was cooking, and then she had the pet bird, and the pet bird actually died because she was cooking with the Teflon pans. So you can see the little animals are more sensitive. We're just bigger bird. You know, we're not different.
Right.
So if it can kill a bird, you better take care of it. Get rid of it.
System, yeah.
Organophosphate, basically the pesticides, herbicides, fungicides, they are endocrine disruptors. I want to mention, organophosphate, glyphosate is a organophosphate. Glyphosate is in Roundup, lots of weed killers.
Yes.
It's number 1 sprayed chemical in the U.S.
Yes.
You want to make sure you avoid Roundup, okay? Please. Glycoester is basically used in lots of the cosmetics and cleaning product. Make sure you use natural cleaning product that's made of essential oil, citrus, a lot of good stuff. Okay.
I just want to say the best way that I find to clean your sinks and counters, which I don't use it in my mouth, but it's actually go to the dollar store and get mouthwash. You can really clean the count. I mean, your chrome is so beautiful. Your toilet smells fresh. But just go to the dollar store and get some mouthwash to clean up your bathroom. It's really amazing.
Yes. That's fantastic. Now we only have we have 8 minutes. We want to talk about detox. People are really concerned about detox and confused too. What I want people to focus is a intracellular detoxification. People don't understand. If you're just having colonic, sauna, exercise, eating fiber, you're just eliminating more toxins.
Right.
But the intracellular hormone disruptors are much smarter than you.
Yes,
Trust
they
me.
are.
They tend to bind the cellular receptor stronger than your own estrogen. So you got to have a cellular mechanism called the glucuronidation. Glucuronidation is different from glutathione, okay? It's actually a biochemical processing of the chemicals utilizing glucurate, which is produced by your liver, to bind the toxins and peel it off. So it's very important to know that. And once the toxins are bind to glucurate, it's no longer toxic to your body, then it's going to be transported to the liver, and the liver will come out from the small bowel. You want to make sure this process is complete. You want to eat a lot of fiber. You want to take more glucurate to prevent recycle. You want to make sure the elimination is 2 to 3 bowel movement a day. Just something very simple. Your cellular, liver, elimination. So that's
Right.
a complete circle.
And when
You
we
don't want to, you
yeah,
don't want to have just sweating or
no,
just pooping.
no,
That's just not enough.
not enough. And when we're looking at liver, there, and we won't get in it today. We will when we have you back next month, and look at the phase 1 and 2 with liver detoxing. So we're going to get more into that, and we don't want you to just listen to the show and go run out and buy these type of products, because not all products are created equal. What she and I work with are products that have been researched, and so we know by lab testing, we know by not so much in how you feel, but at a cellular level, everything's been tested. So this is what I do at NuWellness, and this is what Dr. Lu does. It's just amazing. But please, in listening to the show, don't run out and buy these different type products. You want to have the right products. And I know we're about to wrap up here, and I want to say, Dr. Lu, you have a wealth of information. We will have you back next month. We're going to come up with a date of the month so everybody know you're here. But I do want you to, if you can sum up everything in 30 seconds or less, because we're about over here. What can you tell our audience? 30 seconds or less.
Okay, so I think 3 things. Number 1, detoxify yourself on the daily basis. Number 2, eat very clean. So what is clean? Is organic as much as possible, whole food, so you can avoid all these chemicals, mostly plants. Plants have fiber, phytonutrients to help you, okay? So then daily cleanse, whole food, plant-based, organic food. Number 3, move your body. Your lymphatic need to move. Your body needs the earth's energy, and get out and move.
Yes.
Thank you so much. I'm so grateful to know you, Dr. Lee.
I'm so grateful to know you. And don't leave, because I want to tell people really quick. And when you get up in the morning, if you just take your legs and go back and forth real fast, back and forth, till your whole body starts to shake, that is a very good way to start waking up the lymphatic system when you first wake up. There are some exercises, and we'll go over them later. But I just want to thank everyone for tuning in. Please share, and subscribe to NuWellness TV with Dr. Lee on our YouTube channel. And I want to thank you so much for taking the time to tune in today to listen to the show. Please share. As I always say and end the show, please repeat after me, because words are power. We know how powerful the I am is. I am
so
grateful that I am a magnet for miracles. Everyone, hug somebody, love yourself unconditionally. Have a blessed week.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.
Dr. Lu? Okay, I'll call her. Okay. Yeah, so I think having... Oh.
It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good morning. Good day, everyone. I want to thank you all from the bottom of my heart for tuning in. There's so many places you can be and so many things you could be listening to, but you're tuning in right now, listening to NuWellness TV with yours truly, Dr. Lee. I want to thank you. I am so excited for my guests who I have today, and because we're covering a topic that so many people are having so many problems with. I was in the store in the market last night and ran into a dear friend and told her what the topic was going to be today. And she said, that's one of my problems. Oh my goodness. I'm so happy that you're having a topic dealing with environmental conditions as it relates to the libido of men and women. But I want to just say that my guest is a renowned known. And she studies hard. She is an MD, PhD, Dr. Lu. She is